Hello friends, welcome to another important topic of ENT, that is anatomy of osteomeatal complex and staging of chronic rhinosinusitis. So many a times question comes in your exam write a short note on the anatomy of osteomeatal complex, and sometimes it gets very tricky as students often get confused about the anatomical landmarks and what exactly osteomeatal complex is. So basically, osteometal complex is also known as Piccadilly circle, and it can be divided into two parts, that is anterior osteometal complex and posterior osteometal complex. As we all know, all the paranasal sinuses can be divided into two groups, that is anterior group of paranasal sinuses and posterior group of paranasal sinuses. Anterior group of paranasal sinuses include frontal sinus, maxillary sinus, and anterior group of ethmoid sinus, while the posterior group of sinuses that include posterior ethmoid sinus and sphenoid sinus. So, what is anterior osteometal complex? It comprises of infundibulum, maxillary ostia, frontal recess, and it is situated in the anterior ethmoids. What is infundibulum? Most of the students don't know about this. So infundibulum is basically a funnel-shaped pathway for the drainage of sinus ostia, and this drainage belongs to only the anterior group of sinuses, that is anterior ethmoid, frontal and maxillary sinus. While the posterior osteometal complex is situated in posterior ethmoids, it drains posterior ethmoid sinuses and sphenoid. It comprises of sphenoethmoidal races. Races is a space that is situated above the superior concha and superior meatus. What is superior meatus? It is a space below the superior turbinate. So here it is a handmade diagram by me of the anatomy of osteometal complex. Here, as we can see in this diagram, there is a middle turbinate and there is a bulla ethmoidalis. B stands for bulla ethmoidalis. Basically, it is an anterior ethmoidal cell. And there is infundibulum. Infundibulum, as I have explained already, that it is a pathway for the drainage of sinus ostia. And there is an uncinate process. There is a hiatus semilunaris. So all these combinedly form a complex that is known as osteomeatal complex. This is a simple line diagram. In books, you have very complicated diagrams. At times, it is difficult to understand from there. So this diagram you can draw also in your exams, and it will work. So coming to the staging of chronic rhinosinusitis, as there are multiple staging present today in the textbooks, but there are a few important stagings which I have mentioned here. First one is Mackay staging. It is based on findings of CT-PNS. So score is allotted from 0 to 2. If there is no abnormality in the CT scan, the score will be given, that is 0. If there is partial opacification of the sinuses, the score is given 1. And if there is total opacification of the sinuses, the score is allotted 2. So coming to the next staging, that is Friedman's staging. It is also based on CT scan. So the stage 1 describes about the single focus of disease. Stage 2 defines multifocal disease that is responsive to conservative therapy. What is conservative therapy? Simply, we can give antibiotics and nasal steroid sprays, nasal washes, steam inhalation, etc. And stage 3 corresponds to the diffuse disease that is partially responsive to medication, and stage 4 corresponds to the diffuse disease with poor response to therapy, that is conservative therapy, and there will be bony erosion also. So that corresponds to the stage 4. Coming to the next few more staging, one is Lindholz's grading of nasal polyp, and another one is basically a classification, that is James Baranow classification. So this classification is important as we commonly see in our clinical practice. Usually consultants write in a short form like CRS, WNP. So many a times students or patients get confused at what is this, what does it mean. So what is CRS WNP? It signifies chronic rhinosinusitis with polyposis, and CRS SNP indicates chronic rhinosinusitis without polyposis. Here S is a Latin word that indicates a word sign, SINE, that means without in Latin. Okay, so these are the two classifications. CRS-WNP, that is chronic rhinosinusitis with polyposis, and CRS-SNP, that is rhinosinusitis without polyposis. Next is the Lindholz grading of nasal polyp. There are three grades basically. Grade 0 where there is no visible polyp, grade 1 when the polyp is confined to the middle meatus only, grade 2 when the polyp is situated below the middle turbinate, and grade 3 is when polyp clearly obstructing the whole nasal cavity. So that is the grade 3. It is a grading of nasal polyp. So there are four grades that starts from grade 0 and it goes up to 3. There is one more criteria, that is Benton-Cohen criteria in rhinosinusitis, that we will discuss later on when we will discuss acute and rhinosinusitis separately. So thank you all for joining and keep learning and keep growing. Please like, share and subscribe my channel. Thank you.